We have an app platform that's downloadable for connected TVs and tablets that features content that's specifically crafted for people living with dementia to be digestible by and engaging for them.
Welcome to Startup Health TV, where we celebrate the entrepreneurs and the innovators who are transforming health. I'm Logan Plaster, here with Bill Uniowski, the CEO and co-founder of Zinnia. Bill, always good to see you.
Great to see you as well, Logan.
I got to see you not too long ago at AAIC in Philadelphia and got a sense of what you've built, but I want you to explain that to the viewer. But I just appreciate the backstory. So I hope you can just sort of let us in on how Zinnia came to be.
Sure, absolutely. Well, to start, Zinnia is therapeutic TV for dementia. We have an app platform that's downloadable for connected TVs and tablets that features content that's specifically crafted for people living with dementia to be digestible by and engaging for them. So slow-moving, gently paced, free of plot and dialogue, and it's super engaging. And caregivers will use this as a tool to reduce agitation, to support activities of daily living like drinking water or taking a shower that people might be resistant to doing, and to engage and connect and spend time with the person that needs support.
For folks that have not been involved in Alzheimer's or caregiving, talk to us about current standard of care in terms of plopping somebody down in front of a TV, the challenges of daily living. Walk us through some of that.
Sure, absolutely. So with dementia, someone is slowly losing their capacity cognitively to do various things. And so you need to do things more slowly, more gently. Typically, there's that standard view of someone just watching television, watching something mindless, not engaging with it all day long. And so, we strive to create a better alternative to that, that, meets that person where they are, arrives and treats them with dignity. And it comes from the experience of my co-founder, who was a dementia family caregiver to her husband, who was diagnosed with dementia. And so she very quickly realized that regular media was not working for him. It was causing agitation or boredom or stress. And so she started building videos herself with pictures of their kids and their dogs and their vacations, but then wanted more. And so as we started doing this, we found that not only are these effective, but they can do so much more than just entertain someone.
Yeah, something I found interesting about hearing her story was that it's not just ineffective, actually, the plots and the stress of a show can really be detrimental to somebody.
Sure. So sometimes people can't understand the difference between fact and fiction.
Yeah.
Sometimes fast-moving dialogue can be confusing because you can't track it and follow it because it takes longer to process things with someone with dementia.
Yeah, heaven forbid you're plopped in front of the nightly news, night after night.
Absolutely. Or a triggering commercial or an inappropriate topic. And so, our ecosystem of content is, research-backed and dementia-friendly. And so everything you see on there will be made with someone with cognitive changes in mind to make sure it's appropriate for them.
Yeah. So it's one thing to watch something that's soothing and it's just sort of making you feel a little better. But I've read that this actually has this sort of almost therapeutic, you said therapeutic,
yes,
ability. Talk to me about the ability to pull back on some of these harsh antipsychotic drugs, these calming drugs.
Yeah, absolutely. So, one of the first testimonies that we received about that, we were at a conference similar to this, long-term care. Someone came up to us and said, we have a resident that's regularly agitated, and we have to give her a dose of antipsychotics every single day. It's causing her health to decline. She's a fall risk. And I knew that she was a pediatric nurse, and I thought, hey, next time, let me just show the Zinnia Babies video and see what happens. And within 2 to 3 minutes, the woman had noticeably calmed down. She was cooing at the screen and reaching out. And so they worked with her doctor to change her care plan. And so now they no longer give her that antipsychotic, they show her Zinnia. And the similar thing happened in the research we did in Canada with the University of British Columbia and Vancouver General Hospital. Similar gentleman, the CARS video did it for him. And it was a huge difference. And so that's something that we're looking to study with some ongoing research that we're doing. We're looking into resident agitation and other things like that.
Obviously, that's better for the patient instead of stabbing them with a drug. They're watching this soothing video. How much better is that for the caregiver? What impact does it have on them to be able to give them this soothing therapeutic video versus having to give them a rescue drug?
Sure. Well, caregivers tell us that 79% of our subscribers say that Zinnia reduces their own stress.
Fascinating.
So just, and anecdotally we hear from people that I like watching it too, or I like having it on in the background because it just calms me down. Caregiving is a really, really stressful thing, especially when it comes to dementia. 60% of caregivers rate their stress as high or very high. 40% suffer from depression, and 33% see their own health decline. And the vast majority of people with dementia are being cared for at home by their loved ones in an informal caregiving scenario. So this is really a strong tool to reduce agitation and to reduce stress, and also give the person a bit of, the caregiver a bit of respite. So if they can find something that is safe and is not going to trigger them, the person they care for, that's enjoyable and engaging for 10 minutes, they can do something around the house that they haven't had a chance to do.
You mentioned some new research, so tell me a little bit about that. That seems like an important piece of this, because folks could see this as sort of a simple, slow TV without the clinical backing that you have.
Exactly. So I mentioned our research in Vancouver with Vancouver General Hospital and University of British Columbia. That was 2 years and resulted in some published papers. But we're doing more now. We're actually going to be looking at postoperative delirium in a hospital setting, which is a very significant problem amongst older people who go under anesthesia for a surgery and come out. So we're looking at that. We're also looking at resident aggression in long-term care with other partners. So we're really excited to see that come to fruition and be able to report, more outcomes-based data around the good of our videos.
What's the general reception been like from the market? Because your pitch is, I think, unique. I don't know other companies doing therapeutic TV, it's a video for dementia.
Sure. If you understand dementia and that's part of the world that you live in, it's very understandable quickly, and they get the pitch. If people don't understand it very well, it takes a bit of education about what is dementia, what is that, how does that affect a person, what are the caregiving stresses and burdens, and then trying to convince them that it's just, like you say, it's not just slow TV. It looks simple, but when you watch it with someone with dementia, you watch their reaction, you see how that changes, then that's when the eyes widen and everyone says, oh, okay, now I get what you're doing here.
And then you have to connect it to who's going to pay for it and kind of what the business model is. Help us understand a little bit more about the business model.
Sure. So right now, because it's an app that you can download and use, it's applicable across all sorts of caregiving. So we work with hundreds of individual family caregivers who are in the home. They download our app. It's $9.99 a month or $69.99 a year. Yeah. But we also work in long-term care communities who buy it for the community and use it in common areas and as part of activity programming. And we work with adult day, anyone who has a connection to dementia care. We have a way for them to access Zinnia and improve, the caregiving experience.
How big do you see that market as being?
Well, there are 55 million people globally right now with dementia. It's going to triple by 2050. So the market is very large. The vast majority of people, like I said, are cared for at home by their family care partners. CMS, the Centers for Medicare and Medicaid, recently came out with a new guide program for dementia care, which is really a very comprehensive care model with very clear reimbursement. And for the first time, a model includes caregiver education, caregiver respite, and caregiver support. So this is going to be a larger movement as we see that grow.
So you feel like a tide is shifting in that regard?
Most definitely. I just recently, the Harris campaign came out with a whole bunch of a new directive and policy proposed about caregiving and supporting that. So yes, the tide is most definitely shifting.
Awesome. Well, Bill, I appreciate the update. I think what you're doing is, it is beautifully, elegantly simple. It's not simplistic, but the idea of it, and I think oftentimes the best ideas are. And I love that it comes from such a personal place. So I wish you the best in the next year.
Thank you, Logan.
All right. Take care.